Hello friends, I am Dr. Sachin Kuber from www.circumcision-clinic.in and I am the chief surgeon. Today's topic for discussion is the tight foreskin. The foreskin on the penis which is not easily retracted behind. This condition is called as phimosis, or many patients do not have phimosis but they have a condition in which the foreskin is very tight. When the penis is flaccid or non-erect position, it can go back, but when it becomes erect, the foreskin does not go back. So this is a issue faced by many patients and we regularly see such kind of patients. So there are different treatments and surgery for different conditions. The first and the most important is phimosis. In this there is a very fine pinhole opening in the foreskin that is covering the glans penis, and because of that the foreskin never retracts on the glans penis since childhood. So many patients come to know when they are about to get married or just married, they understand this problem, and because of that they come to us. So this condition is called as phimosis, in which the difference has to be noted that the opening in the foreskin is so small that even when the penis is not erect or it is erect, in both the positions the foreskin cannot go back. This is condition number one, called as phimosis. Now this is very common, but the second condition is also there, in which the foreskin that can retract on the glans penis when it is not erect, and when it becomes erect it stucks up in the middle of the glans penis, or it does not completely come behind the glans penis. Usually it should come, but while erect position that opening becomes small and it causes a ring formation on the glans penis, and this is a case of tight foreskin. So these are the two very important conditions. Many times because of this tight foreskin people try to have sex, and because of that there are many times small lacerations or small wounds form over there. Sometimes bleeding might occur, and this condition becomes very painful for these patients. Or there is another condition in diabetes also. The patients who are suffering from diabetes, they also have sometimes the skin becomes tight. What happens? Because of many small infections or small cuts, that skin loses its elasticity, and while healing that wounds, it becomes very tight and it never comes back. It gets stuck up in the middle or in the forefront. So this is also another tight foreskin condition in diabetes. The fourth condition is called as balanitis xerosis obliterans. This condition is also, in short form, it is called as BXO. This condition, when there is a history of some cut on the foreskin while having sex or while having masturbation, and because of that this foreskin gets abnormally healed and the front portion of that skin looks whitish, and that white part is fibrosis, that is non-elastic tissue, and because of that fibrosis the foreskin gets stuck up and a phimosis like condition occurs. So broadly these are classified as, if the skin does not come back from childhood, it is called as congenital phimosis, and after a few conditions like balanitis or because of the diabetes infection is there, because of that the skin stucks up at the glans penis, and that is called as acquired phimosis. So either there are two conditions, congenital phimosis or acquired phimosis. So for phimosis, congenital phimosis or the acquired phimosis like diabetes phimosis or the BXO, the treatment is always a circumcision. But if the condition in which the foreskin can go back while it is not erect, and when it is erect it gets stuck up inside the glans penis, then there are few medicines which we can try. We can offer you that after checkup, not on phone or not on WhatsApp. We can do a checkup, and if possible we can try that for 3 months, and after 3 months if that skin does not become loose, we can go for circumcision. This is the treatment, and the best circumcision treatment, as you know, we offer is a stitchless circumcision. And let me show you, this is the best circumcision which we can do, and this is called as ZSR circumcision. This ZSR circumcision is done in 10 seconds, and it helps to get to work immediately on the same day or the next day. It does not require you to stay at the hospital, or you don't need to rest at home. And this is very useful in today's world, that just this small mechanism helps to give you immediate results in circumcision. There are no stitches. These are the two parts. This one part goes inside the glans penis, and this is attached to this place, and this is given this as a twist, and once it is there you can cut it, and the circumcision is done. And believe me, it is painless, bloodless and stitchless. So you never have to worry about the circumcision, because last few years I am doing surgery for circumcision, and all the patients are worried about the pain. So let me tell you that this ZSR circumcision which I am talking with you is completely painless. It does not give you pain. Only small minor discomfort will be there after surgery. There will be no pain, no bleeding and no swelling. So once this is done, you can easily come over this problem of the tight foreskin, phimosis, BXO, diabetes, phimosis. All these types are covered with the help of this circumcision. This is safe device. This is used in a single way. It is not repeated to another patient, and use and throw, disposable, and this gives you the freedom. Forget about the past, that there used to be the scissors which used to cut the skin, and there were stitches which has to be put. But now, because of this newest technique, there is no stitches and no pain. Believe me, there is no pain. Really, nothing to worry about the pain. So I hope this video was helpful to you, and please contact us on our phone number, that is 9823863926, or you can WhatsApp us on the same number. Thank you for patient listening.